Intensive care is so much busier than when we filmed here back in November. A number of patients are under 60, the youngest in their mid-30s. Most were fit and well, like Ali, who works for the West Midlands Ambulance Service. She tested positive along with her whole family, including 2 young sons, on Christmas Day.
I have never been so frightened in my entire life. But being told 2 days ago that if I wasn't put onto a respirator and that they didn't give my lungs a rest, that my 2 small children would not have a mummy, has been extremely frightening. This is real. This is happening. I have unfortunately, very sadly, witnessed 2 lovely people pass away in my time in this hospital, and they were not elderly people. And I am very, very scared. This could happen to me. This could happen to anybody.
To cope with demand, staff are now being drafted in from other departments to help ease the pressure here. Staff who are working 13-hour shifts, 24 hours a day, 7 days a week, as they have done for months.
It's tiring to get up every day and do this. We know once the community rates increase, then we're going to see a peak in hospital admissions afterwards. Our community rates are still increasing, and they were to continue to increase until people stop spreading the virus. That's not the people's fault. It's very infective. So the sooner people lock down, follow the rules, the better we're going to be able to cope in 2 weeks' time.
Over 200 patients are in hospital with COVID in Gloucester and Cheltenham. An average of 20 people were admitted every day in the last week, and that's putting huge pressure on every department.
We're all emotionally drained, and not knowing where that end is coming is really, really difficult. We really hope that this lockdown now and everybody doing what they're asked to do will have an effect, and we're really hoping that in the next few weeks we will start to see the decline and that people will start to get better.
On top of all this, staff in recent weeks have had to deal with a vocal minority of people on social media targeting them, claiming they're lying to the public about COVID. It's the last thing they needed.
I think we were all really very upset, actually. It was really hurtful for all of us as a team, because we've been working incredibly hard and we expect to work incredibly hard. But when you have these conspiracy theories that it's not real, that's really hurtful.
The life-saving care never stops here for people like Ali, who's about to leave intensive care.
My gosh, how grateful I am to all the people who have literally saved my life.
In this second wave, patients are more poorly, they're here in greater numbers, and staff are more tired. Morale is low. Everyone needs a break from this unrelenting virus. Steve Knibbs, BBC Points West.